There are many different types of catheters and lines utilized by medical professionals to access your blood, whether used for taking blood samples, administering medication, or receiving dialysis. The action or process of inserting a catheter into a body cavity. Urinary catheters are used to drain the bladder. Cardiac catheterization, in which a catheter is inserted into the heart through a vein in the arm to diagnose heart disease. Urinary catheter. A urinary catheter is a hollow, partially flexible tube that collects urine from the bladder and leads to a drainage bag. Urinary catheters come in many sizes and types. They can be made of rubber, plastic, PVC, or silicone. There are three main types of catheters: indwelling catheters, external catheters, and short-term catheters. Indwelling catheters, ureteral or suprapubic. An indwelling catheter is a catheter that resides in the bladder. It may also be known as a Foley catheter. This type can be useful for short and long periods of time. External catheters, condom catheters. A condom catheter is a catheter placed outside the body. It's typically necessary for men who don't have urinary retention problems but have serious functional or mental disabilities, such as dementia. A device that looks like a condom covers the penis head. A tube leads from the condom device to a drainage bag. Short-term catheters, intermittent catheters. A person may only need a catheter for a short period of time after surgery until the bladder empties. After the bladder empties, it's necessary to remove the short-term catheter. It's also called in and out, IO, catheter or self-catheterization. Suprapubic catheter. A suprapubic catheter is a type of catheter that is left in place. A suprapubic catheter, sometimes called an SPC, is a device that's inserted into bladder to drain urine. Normally, a catheter is inserted into bladder through urethra. An SPC is inserted a couple of inches below navel, or belly button, directly into bladder, just above pubic bone. This allows urine to be drained without having a tube going through genital area. This type of catheter is usually changed every 4 to 12 weeks. Indwelling catheters are usually required short-term for a number of weeks or months when continuous bladder drainage is needed, but occasionally they are required for long-term use. Nephrostomy catheter. The catheter will be inserted through skin into kidneys. It will allow urine to drain into a bag outside body. In some cases, it may also drain into bladder. Placement of nephrostomy catheter, percutaneous, including diagnostic nephrostogram and / or ureterogram when performed, imaging guidance, e.g., ultrasound and / or fluoroscopy, and all associated radiological supervision and interpretation. New access. The physician inserts a catheter through the skin and into the kidney for drainage of urine and / or for an injection. With the patient lying face down and the puncture site having been identified, a local anesthetic is injected. A needle with a guidewire is slowly advanced into the kidney under fluoroscopic guidance. The needle is removed when urine flows back through and, if necessary, the tract may be dilated to accommodate the catheter or nephrostomy tube, which is advanced over the needle, and the needle is removed. The catheter or nephrostomy tube is fixed in place and secured on the skin with a drainage bag attached. These codes include diagnostic nephrostogram and ureterogram, imaging guidance, and all radiological supervision and interpretation. Convert nephrostomy catheter to nephroureteral catheter, percutaneous, including diagnostic nephrostogram and or ureterogram when performed, imaging guidance, e.g., ultrasound and or fluoroscopy, and all associated radiological supervision and interpretation, via existing nephrostomy tract. A previously placed nephrostomy catheter is converted to a nephroureteral catheter via percutaneous approach along the current nephrostomy tract. The patient is placed face down and the conversion is performed over a stiff wire. Contrast is injected through the catheter to better visualize the kidneys and ureter. The wire is advanced and the catheter is replaced over the wire and the wire removed. Imaging guidance assures proper placement and the new catheter is secured to the skin with sutures. This procedure includes diagnostic nephrostogram and or ureterogram, imaging guidance, and all radiological supervision and interpretation. Exchange nephrostomy catheter, percutaneous, including diagnostic nephrostogram and or ureterogram when performed, imaging guidance, e.g., ultrasound and or fluoroscopy, and all associated radiological supervision and interpretation. The provider changes a nephrostomy catheter by replacing the existing tube. Sutures holding an existing tube in place are removed. A guide wire is inserted through the tube and pulls the tube back out over the wire. A new tube is threaded over the wire until proper placement is achieved. The wire is removed and the new catheter is sutured to the skin. This procedure includes diagnostic nephrostogram and or ureterogram, imaging guidance, and all radiological supervision and interpretation. Ileal conduit. An ileal conduit is a system of urinary drainage which a surgeon creates using the small intestine after removing the bladder. To do this, the surgeon takes a short segment of the small intestine and places it at an opening he has made on the surface of the abdomen to create a mouth, or stoma. Change of ureterostomy tube or externally accessible ureteral stent via ileal conduit. The physician changes an ureterostomy tube or an externally accessible ureteral stent via an ileal conduit. To remove the existing tube, the physician takes out the sutures securing the tube to the skin. The physician inserts a guide wire through the tube and passes the tube back over the guide wire. The physician passes a new tube over the guide wire, removes the guide wire, and sutures the tube to the skin. To change an externally accessible ureteral stent via an ileal conduit, a guide wire is inserted through the ileal conduit. An ileal conduit is an isolated loop of ileum to which the ureter has been anastomosed at one end with the opposite end exiting through the skin and attached to an ostomy bag. The existing stent is retrieved and a new stent is placed. The guide wire is removed. Catheterization and introduction of saline or contrast material for saline infusion sonohysterography, CIS, or hysterosalpingography. A small catheter is introduced into the cervical opening and a saline solution or liquid radiographic contrast material is injected into the endometrial cavity with mild pressure to force the material into the fallopian tubes. On X-ray films shows the uterus and fallopian tubes for any abnormalities or blockages. CIS means saline infusion sonohysterography. When sonohysterography is performed, a thin catheter is inserted into the uterus and 1 to 2 teaspoons of saline solution is injected into the uterine cavity. Endovaginal ultrasound is performed with the saline solution acting as a contrast medium to view any abnormal anatomic findings in the uterus.